Hello everyone, I'm Dr. Divya Madan. Welcome back to my YouTube channel. A brief introduction. I am currently a third year pediatric resident in SMS Hospital, Jaipur, having secured an All India rank of 1400 in Neet PG 2020. So this video is regarding Neet PG 2023 pediatric section recall. So I have included all the questions which were somehow related to pediatrics, or a case scenario was given where a child was described. So it's up to you. You put it in the biochemistry section, you put in the pathology section. So there is a list of 23 questions. I will just roughly go through them, and yeah, the chat box or the comment section is open for discussion. If you have any doubt, you can drop your comment down in the comment section. So without further ado, let's get started with this video. So the first question was, a child was brought with pedal edema, chiliosis, cardiomegaly, and the question was which vitamin deficiency is most likely. So pedal edema, chiliosis, cardiomegaly, it's thiamine deficiency. The second question was classical scenario 3D or 4D that we study in pellagra, that is diarrhea, dementia, dermatitis, death, and they asked about which deficiency it is. The answer was niacin deficiency. Again, the third question was related to a micronutrient deficiency. So I could see a lot of deficiency questions, and therefore micronutrient deficiency is a really important topic that you need to brush out at the end go, especially in NEET PG. I can list out around 7 to 8 questions that focused on the deficiencies, right? So coming on to the third question, in the question they asked that a child was there with perioral rash and there was delayed wound healing. What deficiency could be there? The answer to this question was zinc deficiency. Question number 4, there was a 2-year-old child with scalp scale dermatitis, and there was a pointer that the child has been consuming raw eggs daily. The mother tells the physician that I've been feeding the child raw eggs daily. So what is the vitamin deficiency? Raw eggs pointer, it is biotin deficiency. Question number 5, 6-year-old boy came with the complaints of muscular pain, especially in calf muscles. There was fatigue and there is limited ability to exercise. What is the diagnosis? Right, out of all the options, the most suitable was McArdle's disease involving only muscles, right? Question number 6, a child with mental retardation was there, and there was cherry red spots and no organomegaly. Cherry red spots, no organomegaly, it's Tay-Sachs. Question number 7, it is classical black urine in infants is caused by, the answer is alkaptonuria. Question number 8, it was an image based question. Image of bone marrow aspiration and peripheral smear for a child was given with pancytopenia. So a child with pancytopenia, with the picture like this on bone marrow, you can see typical cells, Gaucher cells, crumpled tissue paper appearance, and the enzyme deficient in the Gaucher's disease is glucocerebrosidase. So in this question, it was a biochemistry question. Take it as a pediatrics question, take it as a pathology question. They didn't ask the disease, but they asked the enzyme deficient, that is they asked the pathology per se, that was glucocerebrosidase enzyme deficiency. Question number 9, they had a neonate with a triad. There was a heart defect, that is PDA, there was cataract, and there was hearing loss. The age-old mnemonic CHD, that is cataract, heart defect, and deafness. It is a classical triad that is seen in congenital rubella. Question number 10, there was a baby whose birth weight was 1 kg and he was born at a gestational age of 36 weeks. He presented to you with petechiae, hepatosplenomegaly, and periventricular calcifications on CT. So coming on to the first point, a 36 weeker with 1 kg weight seems like a small baby. It is an IUGR baby, small for gestational age baby. Now there is petechiae, hepatosplenomegaly, and classical periventricular calcification on CT that is seen in cytomegalovirus infection. So the answer to this question was cytomegalovirus. Question number 11, a child with fever and rash, cough, coryza, could be any viral illness, but the pointer here was Koplik spots, that is classical in measles. Now question number 12, there was a 10-year-old schoolboy and he presented to you in the OPD. Which all vaccines would you recommend? according to the National Immunization Schedule. So here there was two confusing topics, confusing options here. One option was TT, other was TD. So this is an update. Now instead of TT, we give TD at 10 and 16 years of age. So the answer to this question was TD. Question number 13, they asked about best sign of adequate infant growth in an infant with a birth weight of 2.8 kgs. So we cannot get much from the question. Only we can see that it is maybe a term baby that is appropriate for gestational age. So the options were like weight gain of 300 grams per month till 1 year of age, which is a false statement because we know 0 to 3 months there is a different pattern of growth, 3 to 6 months there is different, 6 to 9 months there is different, 9 to 12 months is different, right? In the initial 3 months is at 30 gram per day, right? And then it decreases to 20, then 15 and so on. So there is no an average 300 gram per month growth till 1 year of age. In fact, in the first month, because it is 30 grams per day, it would be 30 into 30, that is 900 grams per month. So by knowing this only, the statement is wrong. Now the second option is there is increase in length of 25 centimeter in the first year, which is true. At birth, the average is 50 centimeter and at 1 year of age, it is 75 centimeter. So the difference is 25. So there is increase of length of 25 centimeter in first year of age is the correct statement. The third is AF closes by 6 months, which is a wrong option. AF can close around 12 to 18 months. So this one is wrong. The last option is weight under 75th centile and length under 25th centile. We don't want length under 25th centile, which is lesser, right? So the correct option would be increase in length of 25 centimeter in the first year of life. Question number 14, a 2-month-old child was given and there was a swelling over the scalps in birth that is progressively increasing in size, and I think some x-ray or x-ray picture was also given where there was not subcutaneous edema but a deeper collection. So the answer to this question was cephalohematoma. The other pointers were, though it is a swelling or over scalps and birth, but success, the caput usually resolves over time, right? It doesn't progressively increase. So the answer to this question is cephalohematoma. Question number 15, a preterm was given with respiratory distress at birth. What is the most probable reason for this? Preterm respiratory distress since birth. The most common diagnosis here would be HMD, hyaline membrane disease, or RDS, respiratory distress syndrome. So in that there is surfactant deficiency. So because of the deficiency of surfactant, the surface tension would increase and the alveoli will collapse, right? And obviously because the alveoli collapse, they take more distending pressure to open up, that is their compliance also decrease. So the answer to this question will be, there will be decreased compliance and increased surface tension, that is option number C. Again, another HMD question. A preterm with respiratory distress in the chest X-ray has ground glass opacity or whiteout lungs. And what is deficient in this baby? The most important component of surfactant is lecithin, and lecithin is deficient in this baby. Question number 17. A 3-month-old baby with jaundice and clay-colored stools. Clay-colored stools in jaundice means there is some obstructive jaundice and there is congenital hyperbole. Biopsy shows periductal proliferation. What is the most common diagnosis? Obstructive jaundice, conjugated hyperbole, and the biopsy with periductal proliferation. The straightaway answer here is biliary atresia. Coming to question number 18, 4-year-old child, episodes of icterus and para, PS shows, spectral smear shows spherocytes. What is the diagnosis and investigation? So icterus and pallor, that means hemolytic jaundice, and in the PS you have spherocyte, it is hereditary spherocytosis, and the investigation we do for HS is OFT, that is osmotic fragility test. Coming on to question number 19, a 10-year-old boy with recurrent bleeds and history of joint pains, no mucosal bleeds, and which coagulation factor deficiency is there? This is a hemophilia picture, and the factor deficiency in hemophilia can be factor 8 or factor 9 deficiency. Coming on to question number 20, a child with fever and stridor, and the X-ray was shown, and the X-ray had the classical steeple sign. What is the diagnosis? The diagnosis was croup or acute laryngotracheobronchitis. Question number 21, they ask chloride levels are tested in which disease? It is tested in CF, that is cystic fibrosis. Question number 22. A 10-year-old child with tachypnea, severe dehydration, signs of shock. It was, I don't know whether it was mentioned or not. The blood gas showed acidosis, pH was 7.1, bicarb was 7. The RPS, that is the random blood sugar, was 550, and the urine glucose was 3 plus. So it is we can all get that it is DKA, that is diabetic ketoacidosis. You see a blood sugar of 550, urine glucose 3 plus, and acidosis picture, and the child is in severe dehydration, tachypneic, and the blood gas also shows acidosis. So what is the appropriate management? So when you encounter such a child, you first stabilize the patient. You ask the child to lie down, secure a mask, oxygen mask, secure two wide bore cannulas, right? And first of all, because the child is in severe dehydration, we give a bolus. This bolus, if there are signs of shock, then you give 20 ml per kg, and if the signs of shock are not there, then you give 10 ml per kg, followed by insulin infusion at the rate of 0.1 unit per kg per hour. So if the question had some signs of shock, then the answer would have been NS 20 ml per kg followed by insulin 0.1 unit per kg per hour. But if the signs of shock were not there, then NS 10 ml per kg. And one important point, that if the child was in shock, you don't subtract this bolus from the 48-hour correction that we give. You don't subtract that. But in case of the child with no signs of shock, this bolus would be subtracted from the 48 hours fluid collection. Question number 23. A child with gum bleeding, and they asked that gum bleeding and scurvy is due to defect in collagen synthesis. Vitamin C is required for the collagen synthesis process. And lastly, a child with bony deformity was shown, and they asked what deficiency it is. Typical bow legs were shown, and we all know it is vitamin D deficiency. So that's it from my side for the recall of some questions from pediatric section in Neet PG 2023. I hope the exam went well, and if all it didn't, you have INI-CT coming on your way. I wish you all the best for that exam, and all the best.